what we've recently seen is three things mainly. The first of which is that a lot of people have missed their oral care during the pandemic. They were scheduled, for instance, last spring, and then since then there's been closures, and a lot of dentists either haven't gone back to work or just simply didn't call the patients back to remind them of their hygiene appointments. So they've gone for a year now without having oral care.
Without a regular cleaning, buildup on teeth can become a serious problem and snowball into a number of other complications.
First thing is, with cleaning, we normally do polishing. So you get a lot of stains on your teeth because we're always drinking coffee, having wine and tea. So that kind of puts, it dampens the smile a little bit. So once you get the polishing and the cleaning, the first thing you see is a brighter smile. Another thing is that the deposits that are on the teeth are just a very nice harbor for bacteria. And this bacteria can sometimes eat away at the bone and cause loosening of teeth or gum inflammation. So you'll have bleeding gums, swollen, red gums. It becomes sometimes painful to brush, and it becomes a cycle afterwards. If it's painful to brush, we normally stop brushing, stop flossing, so it just gets worse and worse. And this is when we have to break that cycle at some point by doing the cleaning. Another thing is that sometimes we have cavities that we don't feel until they get painful, but unfortunately, that pain could indicate that we need something bigger than just a filling, like a root canal or maybe even a crack, and we have to pull the tooth. We've been seeing quite a lot of cracks these days. And partially, I would think, is because everyone's stressed out by what's happening. So people are grinding and clenching a lot, and that's causing sometimes a lot of cracks on the teeth. So unfortunately, we're seeing these trends these days.
There's also been a rise in patients wanting cosmetic dentistry, like bleaching and bonding. Dr. Aldosouky believes this is from a phenomenon she calls the Zoom call effect.
Now, just because people are online all the time, we're having all our meetings on camera, people are focusing more on the way they're smiling, and they can see all the defects and all the problems they have with their teeth right on the screen in front of them for hours on end every day. So they're starting to realize the kind of problems that they have or the kind of concerns that they weren't aware of before, and now they're really very conscious of it, and they want to show off their smile and they want to take pride in the way they look. So a lot of people are opting for cosmetic treatment now to fix the small things that they see on screen, just because you want to have that pretty smile when you're on a Zoom meeting. So it's been very interesting.
Patients are starting to look toward the end of the pandemic, when we won't have to wear masks all the time and hide our smiles.
People are opting a lot for Invisalign and braces to straighten their teeth, because what they're saying is, if I'm wearing a mask for a year or two, I might as well get this over with. It's been in my books for a long time, and it's just about time now. So people are sort of preparing for showing off their teeth right after the pandemic is over and we're able to all smile back at each other.
Reporting for Halton News, I'm Nikki Wesley.